Formulating your research question. You will be spending a significant amount of time working on your research project, so the question that you choose to answer has to be interesting to your peers and, most importantly, to you. A common framework used to define a research question is called PICO. With the PICO framework, we look at several different areas: the patient, population, and problem, the intervention, a comparison, the outcome, and sometimes the type of study. So for the patient, population, and problem, you need to ask yourself a few questions, such as, how would you describe this group of patients? What are the most important characteristics of these patients? From where do they come? And what are their main characteristics? Also, what is the health problem that you are investigating? For the intervention, we're looking at the treatment, drug, or technology that you will be exposing your study participants to. For the comparison, we want to think about what the main alternative is to compare with the intervention. For outcomes, you want to ask what you're aiming to accomplish, measure, improve, or make an impact on. Are you trying to eliminate or relieve symptoms, or reduce the number or severity of adverse effects, or improve functions? Depending on your question, you might also include a fifth line for type or method of study, in which you would specify the type of study you're going to look at. And sometimes T also stands for time factors, such as 1 year after or 3 months later. Let's apply PICO to a real-world example. So in this case, the patient population, we're going to look at women 45 plus with diagnosed acute moderate depression who have never taken SSRI medication for their depressive episodes. For the intervention, we're going to look at exercise and cognitive behavior therapy. The comparison, we're going to look at the use of SSRI medication. For the outcome, we're looking for improved mood. And then the type, in this case, we're going to be looking at a randomized controlled trial over a 4-month period. Let's turn that into a question. Does combined exercise and cognitive behavior therapy in comparison to SSRI improve depressive mood symptoms in women 45 to 65 with moderate depressive disorder over 4 months after treatment begins?